Welcome back to a Simple Low Carb Life video series. We are now starting Module 5, and the topic is side effects worth knowing about. Hopefully you've had a break between videos, and you've learned quite a bit so far, and if you've taken a break in between, then you're probably retaining a lot of this information. So now let's learn about some of the side effects of a low carb or ketogenic diet that one needs to be aware of. And we'll also in the next video learn a few tips on low carb meal planning so that you can get started on your low carb life. As mentioned, there are a few side effects from eating few carbohydrates, few enough that you're in ketosis or the fat burning state specifically, that are worth mentioning. In the high carbohydrate diet, which is the general American diet, any version really, every gram of excess carbohydrates that you're not immediately using are stored in the liver in the form of glycogen. That signals the body to retain 3 to 4 grams of water per gram of carbohydrates that's stored in the liver as glycogen so that they can be stored. That is how they're stored, attached to a water molecule. So, in essence, a high carbohydrate diet actually causes water retention. So if you have high blood pressure, for example, and you've been told by your doctor to limit your salt intake, which also helps you to retain fluids, well, that's wise advice because you're always water retaining and you'll retain even more fluids if you're adding salt to your diet and your diet is primarily high in carbohydrates. However, when you begin to limit your carbohydrate intake, the body will begin to look for carbs if you're not eating them, and it will use up the ones that are stored in the liver until they're all gone. And all of that water will now be liberated or freed up, and you don't need to retain that anymore. So guess what? You're going to be urinating off that extra water. So this fat burning state, especially in the first week or two, has a diuretic or water pill-like effect. You will urinate more the entire diet than you do normally in a high carbohydrate diet. But the first couple of weeks will be very dramatic. You'll be in the restroom urinating every half hour or so, and you'll while you're awake. And at night, you'll probably get up 1 or 2 times. Now, that purpose of that is you're just getting rid of all that extra water that you've been carrying around. Once you have no longer any glycogen stores in your liver, you'll just be urinating the fluid intake that you're drinking throughout the day and not urinating extra fluids off. So essentially, you don't retain any fluids to speak of when you are on a fat burning diet. So when your body loses large amounts of fluids by either urinating or perspiring, if you're an active person and go to the gym to the point and work out to the point that you're perspiring, you're going to constantly be leaching off sodium, magnesium, and potassium with the extra urination and extra perspiring. So if you live in a warm climate, you're not only going to be urinating a lot, but you're going to be perspiring a lot. So essentially, as opposed to a high carbohydrate diet, which water retains, a low carbohydrate diet, you're always losing fluids, and when you lose fluids, you're always losing electrolytes. And again, it acts like a quote-unquote water pill. As long as you remain in the nutritional ketosis or the fat burning for fuel state, again, you're going to be losing fluids and electrolytes regularly. This is the most important thing that you can remember in terms of a side effect of this diet, and we're going to discuss how to treat that. So it's not only important to replace the fluid loss, but you need to replace the electrolytes that are lost regularly, or you can become quite ill. Electrolytes need to remain in a certain balance in the body, and if they're too low or too high, we can have significant and sometimes fatal consequences if they're left unchecked. So potassium losses are easily going to be replaced by eating leafy greens. They contain potassium. They also contain magnesium, which is also lost with urinating and perspiring frequently. However, sodium is not in those foods. Sodium has to intentionally be replaced. Now, the symptoms of sodium loss are very similar to the symptoms of heat exhaustion. And the reason that people feel these symptoms of heat exhaustion is you're actually losing sodium very quickly when you're out in the sun. So a lot of us have been out in the sun too long, sunbathing, at least in the past anyway. A lot of people don't do that anymore, but when I was a child, I was out in the sun quite a bit. And so if you're out in the sun too long and you perspire enough rapidly that you lose sodium, then you will start out with a headache that will progress to fatigue, lightheadedness, weakness, heart palpitations, irregular rhythm, severe muscle cramps, nausea. You can get quite ill, and if your sodium continues to drop and is not replaced, you can end up in the hospital, or it can even be fatal if you let it go completely. So, to avoid this potentially severe complication, you need to add the equivalent of 1/2 to 1 teaspoon of table salt per day, or in other words, about 2 grams or 2,000 milligrams. If you're reading labels, they're usually listed in milligrams, the sodium is. So you need to add the equivalent of that every day while you're in the fat burning state so that your sodium level will remain normal. If your sodium level drops, your potassium and your magnesium will go along with it. So really, really important to keep the sodium level up. Now, for those of you who have high blood pressure, I know that this does not sound intuitive, and you've been told to limit your sodium intake, and we've just learned why that is, because in a high carbohydrate diet, you're retaining fluids. You're no longer retaining fluids, so even if you have high blood pressure, you really have to add sodium back into your diet. You need in total for the day 3 to 5 grams of sodium, or 3,000 to 5,000 milligrams, but most people in any version of the American diet at least usually consume about 3 grams or 3,000 milligrams without even trying. So we're just worrying about the additional 2,000 milligrams or 2 grams that we need to replace. Now, if you're a person that has religiously avoided all salt so that you buy everything that's sodium free, you need to still aim for at least this 2,000 milligrams and possibly more if you're having symptoms of low sodium. So if you're replacing at least a teaspoon of salt a day and you're a person that avoids salt religiously and you still have fatigue, headache, lightheadedness, or any of those symptoms, you need to add more sodium. If you don't want to grab the salt shaker, you can alternately drink 1 to 2 cups of bouillon broth daily. It's very high in sodium. It's intended to be a soup stock, so it's got a lot of salt in it. You can also use soy sauce that's not unsalted. Or you can eat dill pickles, not sweet ones, but dill pickles. Dill pickles are relatively free on this way of eating, and they're usually very heavily salted. So there are a few suggestions of adding sodium to your diet without necessarily using the salt shaker if you don't want to get into the habit of that again. Sea salt is the preferred table salt to use. Now, the other side effect that some people have and some people don't, but your bowels will tend to slow down on a ketogenic diet. Again, because you're losing fluids all the time. So your stools are not as moist, if you will, as they are on a high carbohydrate diet. You're also not eating grains and fruits, which can irritate the bowel and make people have a bowel movement whether they're eating fiber or not. So the easy remedy for this is to add the recommended dietary fiber daily. Another remedy for that is also adding sufficient dietary fat. So if you're adding fiber daily and you're still having hard stools, you probably need to increase your fat intake. So have an extra tablespoon of olive oil, an extra tablespoon of coconut oil, some form of healthy fat that we've already discussed. Now, if you're a diabetic and you're on glucose lowering agents or taking insulin, this is extremely, extremely important and actually can be life-threatening if you don't take heed to this. So if you're not a diabetic, or if you are diabetic and you're not on these medications, then really you can ignore this. But if you're a diabetic that's on insulin, not metformin, metformin is okay, but if you're a diabetic and you're taking insulin, glipizide, or any of the other actual glucose dropping or lowering agents, those are dosed by your physician based on a very high carbohydrate diet that most Americans are eating. So, most Americans eat, I would say conservatively, somewhere between 600 to 700 grams of carbohydrates a day. So your insulin dose, particularly, or your glipizide, is dosed based on that high intake. Now, if all of a sudden you continue to take that same dose and now you're only eating 30 grams of net carbohydrates today, a day as opposed to 600 a day, what do you think is going to happen? Well, that insulin amount or the glycoside amount will drop your blood sugar into the toilet. In other words, it will drop so low that you're going to have to treat it with glucose or sugar and higher carbs to get it back up. So if you happen to be asleep when this occurs, your blood sugar can drop to the degree that you can actually go into a coma or die. So extremely important if you are a diabetic and you're on any medications to lower your glucose and you're not sure if they are affected by your diet or not, you need to speak with your healthcare provider before you start this way of eating. Now, if you're on metformin, metformin is commonly used with a lot of diabetics because it does not directly lower your blood sugar. What it does is not allow the liver to make more blood sugar or more glucose. So it prevents the glycogen that's stored in your liver from being turned into new sugar. So it will never drop your blood sugar. So if you're eating low carb or if you're eating high carb, it doesn't make any difference in terms of directly lowering your blood sugar. So metformin is safe and actually preferable to take if you have diabetes or are pre-diabetic, even if you're on a low carb diet. So the nugget from this is if you're diabetic and you're on any medications for it, do not begin a very low or ketogenic diet, which this is, less than 30 grams a day, without discussing this with your doctor or healthcare provider so that your medications can be stopped or reduced in half or however they want to manage that before you begin. If you have thyroid disease, are taking certain epilepsy medications, certain psychiatric medications, or have kidney or liver disease, you need to talk to your personal healthcare provider before you start this way of eating as well so that your medications can be adjusted. Because as you lose weight, most medications are based on your weight. And as you lose weight, these particular diseases and medications that are used to treat them, the doses will need to be lowered, or some medications can reach a toxic level if they're dosed too high. If you're taking any medications for other health problems, don't begin a low carbohydrate diet without discussing this way of eating with your doctor or healthcare provider to adjust your doses. Again, there are a number of medications that are affected by weight and need to be basically dosed appropriately. Or if you have kidney or liver disease, they need to be changed in terms of their dosage. So while this way of eating is generally safe in every respect, if you're not taking medications, it can become very unsafe if you're taking certain medications, and the only way to know which ones can be affected is to talk to your healthcare provider. All right, those are the main complications that can arise in this type of a way of eating. And we've just completed Module 5, Video 1. So take a little break, and then we're going to move on to Video 2 in this same module. We'll see you when you come back.